My name's John. I live in Prince Edward Island. My journey with kidney cancer began in 2004. I was 48 years of age, and just a routine blood test showed that my hemoglobin was a little bit low, and that led me to see a hematologist who also happened to be an oncologist at the cancer clinic in Charlottetown. And she very quickly discovered a rather large tumor on the renal on my right kidney, and I had a nephrectomy that spring in the spring of 2004. And following that, I had 9 healthy years cancer-free until 2013, when again a routine medical examination discovered a tumor on the renal bed. So 2013, I had further surgery to remove that tumor. And then I had another 15 months of follow-up. But in the spring of 2015, um, my disease metastasized, mostly went to the liver, to my spine, and to a few other areas. So then I started systemic treatment. And at that stage, there was certainly no real discussion or questioning from my part, um, to my oncologist. They said, "This is what we're going to do. This is what you're going to take," and this was the plan. And I started with a drug called Votrient or Zapanib, and I had reasonable stability with that. But at the end of the 1 year, a new drug became available, and I also had a new oncologist. And this oncologist said, if I would like to try it, it had become available through the drug company, and this was the immunotherapy drug nivolumab. And so I began treatment with that, and he gave me some pretty dire warnings that it can go quite badly. But certainly, initially, I had no side effects. I had stability, and that went on for 9 months. It felt like a miracle drug in many ways. But at the end of 9 months, I had a severe reaction to it. Was hospitalized, had to be taken off treatment. I was off treatment for 9 months. We did try to re-challenge after 9 months with nivolumab, but it was impossible. My liver enzymes just shot through the roof. So at that time, and that would have been the autumn of 2017, I started with Sutent or sunitinib. And again, there wasn't a lot of discussion with my oncologist. And then I had, again, another new oncologist that I'm still with. And she's a wonderful doctor. And there's a lot more discussion about possible treatments and what we can try, which I really appreciate. But at that time, we felt that Sutent was the best option. And so we started with that, and I had pretty good stability with Sutent for 2.5 years, and then it began to fail. I started having progression, and so we looked around at other possibilities. And it was at this stage really that I felt I was more of a full participant in my treatment, and discussing the options available. We looked at cabozantinib and axitinib, and we decided that cabo was not part of the formulary on Prince Edward Island at that time, but we discovered we could get it through the drug company. And between our private insurance and the drug company, we were able to get it covered. So we decided to go with that first because axitinib was in the formulary, and I could follow with that if necessary. So I was on cabo for about almost 2 years, and then things last summer kind of went awry. I had I had sepsis, and then I had some problems with my remaining kidney, my kidney function. My creatinine went very, very high, and so I was taken off treatment and had to make a slow recovery. And just 2 weeks ago, I started with axitinib, and again, discussing with my oncologist, um, what were the options, and this seemed to be the best option. I feel I'm much more a participant in my treatment, and we have full discussion about all the options. Um, I have had radiation as well, just for pain control, and that seems to have worked. So right now I'm on axitinib. I'm hoping for stability, and I feel I'm in excellent care with my oncologist. And again, as I said, it's I think as time goes on, you become more informed as a patient. I joined Kidney Cancer Canada. I follow the discussions on the Smart Patients Patient Forum. And I just feel I'm a much more informed patient, so I can bring that information that I gathered to my meetings with the oncologist. Um, she's not at all threatened by anything that I might bring up. We always have a full and frank discussion. And so I would say to anyone, it's very, very important to have an oncologist that you can talk to and will listen to you, and you can have frank discussions about the way forward.